Hello, everyone. I have the distinct pleasure to introduce tonight's event and its moderator. As part of Walden's mission to empower the greater good, we are continuing our Talks for Good series, which is designed to inspire action and provide a platform for leaders to share their thoughts and ideas. Today's Talks for Good will focus on racial inequities in healthcare. Nurses and nurse educators play a big role in championing health equity. Scientific evidence shows that significant disparities in health and healthcare are rooted in the social determinants of health. These are conditions in which people are born, grow, live, work, and age. Additionally, according to the National Academy of Medicine, racial and ethnic minorities receive lower quality health care than non-minorities, even when insurance status, income, age, and severity of conditions are comparable. Our panelists will discuss how nurses and nurse educators can lead the way in combating racism and healthcare inequities by creating inclusive strategies for nursing care of all individuals, ages, and populations. I am especially excited to introduce tonight's moderator. Dr. Sandra Davis is the Deputy Director for the new National League of Nursing and Walden University College of Nursing Institute for Social Determinants of Health and Social Change. She co-chairs the National League of Nursing Taking Aims Committee to raise awareness with nurse educators of societal inequities affecting health and welfare of communities of color. She is board certified as an acute care nurse practitioner with more than 20 years in faculty, administrative, clinical practice, and leadership roles. Prior to joining the National League of Nursing, Dr. Davis was an associate professor and the inaugural associate dean for diversity, equity, and inclusion at the George Washington University School of Nursing. Without further ado, here is Dr. Sandra Davis.
Thank you, Dr. Lindell. I am very excited for tonight's important discussion on racial inequalities in healthcare. We have a prestigious lineup of panelists I am honored to introduce. Our first panelist is Dr. Mahaman Moussa. He is a senior core faculty member in Walden University's Master of Science in Nursing program and the president and CEO of Raouda Medical Center of Tahoua in Niger, Africa. As a certified family nurse practitioner, he has been a faculty member for more than 10 years and worked as a geriatric primary care provider. At the Raouda Medical Center, Dr. Moussa provides free and low-cost care to underserved populations of all ages. In addition, he provides free medical services to the underserved and uninsured patients at a free health clinic in Winston-Salem, North Carolina. Our second panelist is Dr. Ernest Grant. He is the 36th president of the American Nurses Association, which is the nation's largest nurses organization representing the interest of 4.3 million registered nurses. Dr. Grant has more than 30 years of nursing experience and is internationally recognized as a burn care and fire safety expert. He previously served as the burn outreach coordinator for the North Carolina J.C. Burn Center at UNC Hospitals in Chapel Hill. Dr. Grant also serves as adjunct faculty for the UNC Chapel Hill School of Nursing. Last but not least, our third panelist is Dr. Adrianna Nava. She is the president of the National Association of Hispanic Nurses and chief of quality and systems improvement within the Veterans Health Administration. In her association role, she invests in the professional development of Latino nurses by engaging them in community health initiatives and inspiring them to reach higher levels of success. Dr. Nava also focuses her efforts on building the leadership capacity of nurses with a focus on Latinos. Within the VHA, Dr. Nava has focused on developing the nursing workforce to improve the quality of care delivered to veterans. As you can see, we have an incredible group of panelists tonight. Let's get started. Scientific evidence shows that significant disparities in health and healthcare are based on the social, economic, environmental, and broader political factors that influence an individual's life, also known as the social determinants of health. Dr. Grant, why is it important to address these social determinants to improve healthcare for all?
Well, first of all, I'd like to say good evening, Dr. Davis, and thank you for having me on the panel. That is a really great question, and it's something that those of us in the BIPOC community have known all along. I think it just got, the light shined on it, if you will, or exacerbated by COVID as far as what we were seeing. But we have to understand that it's very important to address these social determinants of health. Otherwise, the chronic conditions that we see are going to continue, including, things we must be able to recognize as social economic challenges that create those barriers, or things like access to, to healthcare, or poverty, or food deserts, or discrimination, good jobs, hazardous environments, those things that continue to contributes to a person's health and well-being. And of course, the more you're exposed to those situations without them being addressed, then we're looking at individuals who are going to be coming in, at the very last moment with very extreme chronic illnesses, or illnesses that perhaps could have been monitored, quite some time ago. So it's important that we recognize, the whole myriad of factors that influence, the patient's health status and their health outcomes, like the determinants of health, implicit bias, or even historical systems. But most of all, it's just important that we further the goal of health equity, and we must understand and address all these factors.
Thank you very much, Dr. Grant. Dr. Moussa, you are in the community. And so would you share with us what kind of strategies can be implemented in terms of addressing the social determinants of health?
I think this is a very important question. When we know that, people's employment, people nutrition, and so on have impact on their health. So I think some of the strategies that can be used, especially from nursing perspective, is to do social need assessment whenever we get the chance to have any patient encounter, because we have to remember here, one of the core value in nursing, we are grounded on social justice and community health, community advocacy. So, and additionally, we are one of the most trusted profession, and one of the professionals who are more in contact with patients. So often issues like poverty, transportation challenges, and so on, patient of minority background, research has shown that they are shy to come forward and share that with providers. So as nurses, we need to be proactive whenever we get the chance to explore and also connect those in need with appropriate resources. Thank you.
Thank you. And so I'm sorry, I thought I heard someone. No? Okay. So Dr. Moussa, I'm going to stay on that for a little bit, because the CDC data shows that some racial and ethnic groups throughout the United States experience higher rates of illness and death across a wide range of health conditions. For example, the U.S. is in last place among all developed nations in terms of maternal mortality, with Black women faring the worst. And so in your practice, and I know that you practice and have practiced extensively. Can you share with us a little bit more in terms of what can nurses do? What can nurses do to improve care for racially and ethnically diverse populations?
Thanks for your question, Dr. Davis. But before talking about that, I like to mention that health disparity is honestly a national embarrassment. This is one of the most civilized country in the earth, and we are here in the 21st century still talking about some people cannot get access or have poor clinical outcome because of how they look like or where they are located. Health disparities, unfortunately, is driven by the underlying, social and economic inequality, which is basically rooted in racism. And this is not just, the action of some few. Unfortunately, it's something that is systematic and often in many of our institutions. Just look at any way you would like to look at it. Look at the criminal justice, look at the housing, and so on. So the healthcare is not going to make an exception. And this, personally, it doesn't surprise me because I like history. So when you look at that from historical perspective, as late as 1790, based on the United States Constitution, Article 1, Section 2, Paragraph 2, Paragraph 3, the first census that was done has enumerated 3 categories of races. That's the white and the black, which were classified as 3/5 of a person. Can you imagine 3/5? I don't even know what 3/5 look like. And then the civilized Indians, meaning those who pay tax. So what that telling us is, then and now, race has been a determinant to define who you are and what you can get access to. That at societal level. And healthcare, as I mentioned, is not an exception. A study in the United States involving 400 hospitals has revealed that Blacks are likely going to get angioplasty when they have heart attack compared to white. And they have 1.6 times chance to die compared to white. And so on. A Black woman is less likely to get mastectomy when she gets breast cancer. So when you look at all those, I think it's a tragedy. I can't say it otherwise. The Institute of Medicine call it uncomfortable reality. And I think as uncomfortable as it is, we need to face it and we need to make it a national priority, not because it's a social justice issue, but we need to do that in order to promote the health of our nation, but also for economic prosperity. Now, back to your question, what can we do as nurses? I think, as I say earlier, nursing as a profession is grounded on social justice and advocacy. So one thing that we can do is to raise awareness, especially within the healthcare community, and speak up. Not doing the right thing is not enough. You have to speak up when the wrong thing is done. And we need to have at the hospital level some way to collect this type of data in a way that someone who reported will have no retaliation whatsoever. So additionally, we also need to have more people from minority background into the healthcare, including more recruitment and retention of students and so on. So this type of things are like those. It requires a comprehensive approach, considering the complexity of the problem.
Yes, thank you very much, Dr. Moussa. And so I would like to continue with what you said, Dr. Moussa, because The COVID-19 pandemic has had a disproportionate impact among communities of color, with them experiencing higher rates of hospitalization and death. And Dr. Nava, what different lessons learned and best practices have you seen emerge from nurses on the front line of the pandemic?
Great. Thank you for the question, Dr. Davis. And I do want to touch a little bit about the previous question about the strategies nurses can do, just because that's one of my favorite questions, asking what we as nurses can do. And as nurses, we wear many different hats. And over time, we've taken on a lot of different roles in practice and administration, research, and policy. So from an advocacy standpoint, as nurses, we have a lot of power to promote change within our communities and to advocate for policy change. And as we said, social determinants of health is a definite population health priority, and a way to address population health issues is to advocate for policy change. So the first strategy that nurses can do is to join a professional organization. We can choose which one we want to attend or join, just because there's many of them out there, and learn about the organization, their mission, and sign up and get involved. And as I mentioned before, addressing health equity is a population health priority. If we want to impact a population, we have to be able to influence policy locally, at the state level, and even at the national level. And we can do this when we have a larger voice, and that is through active participation in nursing organizations. And when there was, for the example of maternity health, I wanted to address that with a policy change that Congressman Lauren Underwood from the Illinois District 14 introduced, and that was the Mambas Act. And that's a way for us as nurses to get involved with working with our local politicians to make sure that not only are we aware of legislation that's out there, but that we're advocating for this for our communities. And as more nurses contact legislators and learn about this and speak to legislators, we can advocate through professional organizations to build our voice. And if a nurse isn't ready to join a professional organization, they can still do their part by being civically engaged and being registered to vote. So voting is an important piece of changing policy. And some of the things that I learned about frontline nurses during the pandemic is that they're very resilient. And despite, going through many changes throughout the country during the pandemic, they've been able to rise up and continue to advocate for the populations in need. And especially the nurses within the National Association of Hispanic Nurses, where they went out and volunteered their time to administer vaccines to the communities in need, as well as provide vaccine education, because as we know, the Latino community has had a lot of misinformation about the COVID vaccine. And despite all of these challenges, nurses always showed up at work, and they showed up for their communities to make sure that they were very safe. And we've also heard the voices of nurses in the media talking about the experiences that they've had in the workplace and advocating for change. So if anything, we've learned that nurses, our voice is important, and we need to be engaged within our communities and also within the media so we can advocate for change.
Thank you, Dr. Grant. Yes.
Yeah, if I could add to Dr. Nava's brilliant answer, I very much agree with everything that she has stated. I think one of the biggest lessons learned also is that nurses have, yes, we're resilient, but I think we also have begun to recognize that we can only do so much. And one of the, when I talk with nurses on a daily basis, they are, they're burnout. They're very fatigued. They have a lot of mental health stress that is upon them as well. So I think as we began to plan for future pandemics, and believe me, they are right around the corner, this is definitely something we need to keep our eyes on, is how much are we asking of our healthcare professionals to do. I mean, no one probably more than nurses, since, most nurses work 12-hour shifts. Other members of the healthcare team may do 8 or 10-hour shifts. It's not a matter of that. It's the environment in which they are in that is adding to the stress that, that they are experiencing. So just to, top on what Dr. Nava has also mentioned, I think nurses, one of the big things is that nurses have begun to recognize their limitations. that they need to take care of number one first, because if you can't take care of yourself, you obviously are not going to be able to provide care for the patient, or at least, proficient care to the patient. So they need to recognize that if they need the time out, the mental health rest or whatever, is extremely important that they recognize that, so that they can be available to, return to work and do the work that needs to be done, and not suffer some of the side effects, so to speak.
Dr. Davis, I would like to piggyback on what both panelists mentioned.
Yes.
So I think one of the lessons that we learn is the interconnection between us. An infection in one county will reach another county in a matter of days or so. So also that we cannot be safe in isolation. We have some kind of connection. The world it is a global village. A disease in India can be in Indiana in no time. So those are some of the lessons that I think we learn. And then personally, it's not surprising to me that the minority were disproportionately impacted because of the many chronic diseases that are mistreated, also their health literacy level. And then, the history, people are resistant to vaccine because of many of the things that happen in the past. One thing I like to mention as innovation is the fact that e-health has emerged, and nurses has played a vital role in raising awareness, in educating people about vaccine compliance, about infection control measures. And that has positively impacted the prevalence and incidence of the COVID in many communities. Thank you.
Thank you very much. So this has been really great, Dr. Grant, Dr. Moussa, Dr. Nava, because really, we talk about VUCA and what has come out of the pandemic, the volatility, the uncertainty, the complexity. And so you've really done, really highlighted for us new things, novel things that we need to really start paying attention to, and looking at things that maybe we didn't before, but now we need to. And so thank you very much for that. And I want to go back a little bit and talk more about the nursing shortage. And so according to the U.S. Department of Health and Human Services, nearly half of all nurses are over the age of 50. Furthermore, less than 30% of RNs identified as racially and ethnically diverse. The shortage and maldistributions of nurses has been frequently forecasted in the past. Dr. Grant, how do you see this shortage being different? And how can higher education play a role in addressing the need for more nurses and increasing diversity in healthcare?
That's a really great question. What I see this shortage being different in that, we have always have had a nursing shortage, and I've been a nurse about 45 years now, and but nothing to the extent that this one is. This one is really critical. I actually sent a letter to the Health and Human Services Secretary, Becerra, asking him to declare this particular nursing shortage a national crisis, because this is something that we as nurses cannot fix alone. It's imperative that we bring together the government, the public and private entities to come up with short-term and long-term solutions to the staffing challenges that we're facing today. We also have to work with the Centers for Medicare and Medicaid on methodologies to approach and promote pay equity, for nurses, and also making sure that nurses are working in a safe environment. There's been such a huge uptick of violence on nurses, not only by patients but also in some cases by their colleagues as well. To address the diversity issue along with that, what has been one of my main goals when I became president of ANA 3 years ago was to increase the diversity of nursing I think nursing should be representative of the people that we care for. So we definitely need more minorities and men within the profession. That will definitely help along those lines. But until then, though, we still have to continue to address why is this shortage happening. Part of it we know is the result of COVID, nurses being burnt out and et cetera. But some of it, you have older nurses who are choosing to retire as well. But I still think part of it, we can look at the number of hours that we're asking nurses to work. Recent studies have begun to show now that maybe 12 hours is a little bit too long. When I first started in nursing, we were doing 8-hour shifts, and then we jumped to 12, and thinking that extra day off that you would get during the 12-hour shift would be more restful. But as the public has gotten sicker. More and more demands are being made on nurses and et cetera. We know that 12-hour shift turns quickly into 13 or 14 hours by the time you're able to really leave your institution, and you really don't get home long enough to put your head on the pillow, and it's time to go back again. So there's a number of things that we need to take a look at that would begin to address this shortage, and also, though, making the profession more attractive to people in the BIPOC community, so that we can have an equal representation all the way of every nationality within the profession.
Hey, Dr. Davis, this is Dr. Moussa.
Yes, Dr.
Hey, yeah, I would like to just contribute on the question on what strategy can we use to improve diversity? I think diversity in nursing, diversity in healthcare is a must. It is one of the strategies to close the disparity gap. But also, I think having diversity is likely going to help providing culturally tailored care, which is likely going to improve the healthcare outcome, patient satisfaction, and so on. Now, how can we do that? Well, I think the way to do that is to come up with a comprehensive strategy for recruitment and retention of students from minority background. Often, in most of the universities, what they do is they have a setup, GPA setup, SAT, and so on. Well, people from minority background are predisposed to go to poor performing school, beginning with. They have poor resources. They don't have appropriate support. So they have less exposure? How can you expect someone to have a higher score than his white counterpart who has all those in place? We need to look at it in a comprehensive way, and we need to take into consideration that potential for academic achievement cannot be determined by your standard exam results such as GRE and so on. So we need to look at students in a comprehensive way and give people equal chance, look at other variables. And at this juncture, I really like to say how honored I am to work for Walden, because I work with other institutions before, and we were just stuck with those metrics. At Walden, things are done differently. We are really champion in diversity and inclusiveness, and it reflects in the number of students and the countries where the students are coming. We have students from over 100 countries. Over 50% of our graduates are from disadvantaged background. I think this is something to be proud of. So we don't have just strategies to get the student in, but we also proactive in making sure that students, once they are in, they have proper academic journey, in the sense that steps are putting in place, such as advising, writing center, dedicated faculty who are providing, individualized type of approach to education. And that's why we are unique. And I think it's honestly an honor to be part of Walden.
Thank
Dr. If I could jump in as well.
Yes, Dr. Nava.
Yes, thank you. And I agree with Dr. Grant and Dr. Moussa with this time period being a time of crisis with the pandemic, and it's very different, but also acknowledging that the composition of our nursing workforce is also different. And we're seeing that more and more millennials are making up the nursing workforce now. And I know as a millennial myself, I didn't spend so much time at the front lines, and it was more to, find ways to improve the healthcare system. So I think there's an opportunity to engage higher education with clinical practice nurses in hospitals and health systems in general, because nurses really want to learn how they can improve care through quality improvement, doing data analysis, gaining research skills to improve health outcomes, even in their own practice setting, not necessarily attaining a degree, but just gaining the skills necessary to change and improve healthcare for their patients. So it's also important to note that as the nation's youth, those that are 16 or younger, identified as a racial ethnic minority, which was over half of them of that age. So we do know that the workforce coming in to become nurses are going to more likely be minorities. So how do we make it more inclusive and make sure that we attract these students going in the future?
Excellent. Thank you very much for that, Dr. Grant, Moussa, and Dr. Nava. And so, and Dr. Nava, thank you for really highlighting the importance of academic practice partnerships. And so I want to stay with that nursing education a little bit longer, because in addition to the need for nurses, there's a national shortage of nursing educators. It's also important to note that the National League for Nursing's 2019 Faculty Census Survey showed nearly 82% of faculty are white. Dr. Nava, why is it important to increase diversity among nursing educators? And what strategies can be helpful toward increasing diversity in educational programs? And I know you spoke about a few already.
Yes, thank you. So diversity amongst nursing educators is really important so we can continue to inspire students, especially our minority students who don't necessarily have the networks or the mentors that, or even see themselves achieving higher levels of success. So representation is really important, but it's also important because the faculty bring a different lens and are able to be the voice that sometimes, is not there in the ivory towers or in other academic settings. So it's very important to have them there. And it's important for the students, especially because a lot of minority students are not exposed to different career paths in nursing. And we see a lot of people change their career paths over time because they don't know of other opportunities to do administrative nursing or research. And sometimes students get scared when they hear research, and we do want to, make sure we get nurses that are becoming academics as well. So it's a great way to make sure that we not only increase the pipeline of students that are achieving higher levels of academic success, but also that we have mentors in place for individuals who are interested in going into academia, especially when they don't necessarily think they can, or how to navigate that system.
Dr. Davis, this is Dr. Moussa. Is it okay if I just add something to?
Absolutely.
Yeah, thank you. I think she has mentioned something important. Having people from minority background can be inspiring, but additionally, we are in an era of evidence-based education. So evidence-based education, unlike what we used to do, is a systematic way of using the best scientific evidence in teaching and learning for better outcome. So we know in order to achieve program whatever outcome, we need to take into consideration student style of learning, student learning style. And we all agree all students don't have the same learning style. Educators from minority, and I give myself as an example. I have English as a third language, not a second language, but a third language. But I know firsthand what English challenged me. I know firsthand what's the cultural shock of being in the United States. I know the humiliation of you have a thick language, you don't speak the English the same way. So I know what the students are going through. So having a minority like myself, it's not just inspiring, but it will help to have a student-centered teaching and learning approach. But additionally, people like to come when they are comfortable, and like people are comfortable when they see someone who look like them. So I think it goes in the same line with improving diversity in workforce. Thank you.
Yes, absolutely. And for that, Dr. Moussa. And Dr. Grant, I know you also had a comment.
Yes, thank you. Sometimes I have conversations with deans and directors of nursing programs, and one of the things that I love to tell them to do is when they pull into their assigned parking lot and they get out of their car, and mostly these are white deans, that I encourage them to change their ethnicity. And when they walk into their nursing building, look at it from the perspective of either, a person of the opposite gender or from another ethnicity. And as they walk down the halls and they see the pictures of the former deans, who are probably all going to be older white women, when they pass a classroom and look into that classroom, do they see someone who is representative of the ethnicity that they took on? Or chances are it is not. If so, ask yourself too, how many minority faculty members do I have? And not only that, but how many of them are either instructors versus an assistant professor versus an associate professor, or maybe even an associate dean? If you can't, say that you see this, then there's something wrong. You need to put in place resources that would recruit and retain minority faculty and then you need to go out and actively recruit minority students to come in and let them say, no, that we want you here, and whatever resources that it may need or it may take in order for you to get here and to be successful. It's one thing to have them there, but we also want them to be successful as well. Then make that commitment and make sure that you are, doing what is right, and not just thinking, diversity, equity, and inclusion by saying, oh, we have X amount of, students from this ethnicity or that ethnicity, and that checks the box. That's not it at all. If that's the case, you need to go back and understand what DEI actually stands for. So, but it is important that, it starts at the top, that, because the dean or the provost is going to be the person who sets the agenda, if you will. And so we need to make sure that minority students feel welcome into the program and that they're given every opportunity to succeed as best as they possibly can.
So thank you very much for that, Grant, Dr. Grant. And so really being very intentional. Mm-hmm. And what are those intentional strategies now? And really tracking, monitoring, documenting, all of that to see the change over time. And so this is a good time. We've spoken about so many different topics, from structural racism. We talked about social determinants of health, disparate impact of COVID, mental health issues, nursing shortage, nursing education faculty, and so a lot of things. And I'm sure at this point, you've been thinking a lot about what has been said and have some questions or some thoughts that you would like to share with our panelists. And at this time, I'd like to really open it up for you to put your questions, your thoughts, your comments into the chat box so we can have a discussion, because these conversations are so important.
Dr. Davis, if I may, while we're waiting on the audience to put in their questions, I'd also like to point out that one of the things that the American Nurses Association Board of Directors did last year was to begin to recognize not only the the social injustice that is going on, and subsequently we wind up forming the Commission to Address Racism in Nursing. And I'm proud to say that I am one of the co-leads. Dr. Nava is one of the co-leads representing the Hispanic nurses. We have Dr. Martha Dawson, who's representing the National Black Nurses Association, and Dr. Deborah Toney, who is representing NCMA, or the Ethnic and Minority Nurses Association as well. And one of the things that, the whole goal is to address the racism that we see occurring within the profession so that it could be used as a model for other professions as well. And, we are looking at approaching that on 4 different fronts. And that is education, nursing education, clinical practice, research, and advocacy. And with the eventual plan is that we'll come up with some scope and practice standards, if you will, addressing those 4 areas. And the enforcement piece of that, if you will, is regulatory agencies such as the NLN. When they go in to accreditate a nursing program, they adopt these standards, and then they will say to that program, we've adopted these standards, from the National Commission to Address Racism in Nursing. Show us how that is applied in your educational curriculum. Eventually, that will drive change in the way nursing textbooks are written, because we know that sometimes textbooks are written to stereotype certain ethnicities. So that's going to be a driver of change there, and subsequently maybe even be a driver of change for the NCLEX exam. Same thing in the clinical practice setting. We can, when the Joint Commission goes into a hospital, or Magnet goes into a hospital, and say, tell us how you are addressing racism, through your policies and procedures or whatever. So it's a great way to begin to start the work on that. We do expect that we'll have our first report available on May of next year. There's a lot of things going on in between there. I would invite your audience. We actually have a survey that is out that we're asking all nurses of all races and ethnicities to please participate in that survey so that we can gather the data. We want to hear your story. What racial or racism stories that you might have, so that again we can be drivers of change. So please go to the ANA website, which is nursingworld.org. Again, nursingworld.org. I'm sure Dr. Nava will encourage some of her members to go to their website as well. But please take that survey. It only takes about 6 minutes, but the information that you will give us is so valuable. And we need that in order to get a very clear picture of what is going on, particularly with nurses of color.
Thank you very much for sharing that information with us, Dr. Grant. And that reminds me that we're at the point now, and a point in time in history, and the history of nursing, where we are really focusing on structural racism. But not only are we doing that, but also moving toward, okay, so what are the policies, the regulation, the legislation, all of that together. And so that's why the Walden, the National League of Nursing, and the Walden University Institute for Social Determinants of Health and Social Change took this really bold move to start the Institute, because that is, for example, in nursing education. Mm-hmm. And so in our curriculum, what does our curriculum look like in terms of teaching about social determinants of health, teaching about structures and systems? And so the Institute really is to develop leaders and catalysts for social change. And so to create these leaders who are going to create the curriculum, and really put into their programs what needs to be in the curricula and the programs in terms of structural racism and other things, social determinants of health. But not only the curriculum, but also, as you said, generating that knowledge. And so that new knowledge, the research, really looking at how do these things operate and what's the impact, and then the broad dissemination. And so now we are really, I'm glad to hear that, because we are really starting to put into place in our various areas of practice, of education, of policy, all those things that are needed to make change. So, questions from the audience. We have about, let's say, we have a few minutes still for questions. And we did have one question come in, and I'll start with that. The pandemic has wreaked havoc on healthcare practitioners. It was reported Filipino Americans account for 4% of nurses in the US, but about 25% of COVID-19 deaths among nurses. What is the nursing community doing to address this?
Well, I think I'll take the first stab at that question. One of the things that ANA has been doing, and the American Nurses Foundation, since the start of the pandemic in January of last year, we've been doing a series of pulse surveys, if you will, of nurses, and trying to figure out what it was that nurses needed. Some of the results of that, obviously, they needed education on how to take care of the COVID patient. They needed, we advocated for them to get the proper PPE equipment that they needed, and et cetera. They also, we first began to report about the mental health and fatigue that nurses were experiencing as well in March of last year. And that was just the very beginning of that, when we were like 2 months into the pandemic. So you can imagine, here we are now, 19 months later, and that is still a problem that is there. One of the other things that the survey did show was that minority nurses, and including nurses from the Philippines, but the Latinx, the African American nurses as well, they were more than likely than their white counterparts to actually care for a COVID patient. They were more than likely to be hit financially as a result of when hospitals closed down and were only accepting COVID patients. They were more so to either stop paying on their student loans and things of this sort because of having to stretch the dollar. So the main thing what the nursing community is trying to do to address this is obviously, again, getting nurses to pay attention to their health. Again, you've got to take care of yourself. You've got to also, if they have not been vaccinated, they need to take the steps to do that as well, so that they're not exposing themselves, their colleagues, or the patients that they were caring for to possibly succumb or to become ill with COVID as well. But the main thing, of course, is making sure that nurses are getting the adequate rest. There's been several. We put up, several things on our website. There's the Healthy Nurse, Healthy Nation campaign. There's the Well-Being campaign that we did in conjunction with the Association of Critical Care Nurses, the Emergency Room Nurses, as well as the Psych Mental Health Nurses Association as well. Things for the nurse to be able to access so that they can continue to promote well-being for themselves and resiliency. That's the main thing that we really want to emphasize, that it's important for the nurses to be able to take care of themselves and then be healthy enough to provide care to the patients that need them.
Thank you very much, Dr. Grant. And another question, with the shortage of culturally adept nurses, how can we improve the unfair and lengthy processes immigrant and internationally trained nurses face when trying to get licensed in the U.S.?
I think that's a challenging question, just because the licensing process and education requirements in different countries, for example, in Mexico or other Latin American countries, just from my experience with some of these nurses, it can be difficult just because there's different requirements and depending what state you're in. So it's definitely a challenging question, and one that as an organization, as NAN, we have been looking into. And I encourage more members, if you know anybody or nurses in general that are having these difficulties, to join NAN and prioritize this, because the more we work together to address this, the faster we might be able to come up with a solution.
Okay. Thank you, Dr. Nava. And then the next question is equity. How are major nursing associations addressing pay disparities that affect minority nurses?
I guess that's my turn to begin to answer that. One of the things is obviously, as we're seeing right now, nurses who are choosing to become travel nurses that may make anywhere from 3 to 4 to maybe in some cases 10 times their hourly salary when they were before they became travelers. That does lead to a huge amount of pay inequities. And one of the things that we have been stressing is you cannot forget about the nurse who is showing loyalty to the institution by remaining there. Obviously, their salaries need to be increased as well. Obviously, they're not going to be able to pay them as much as they're able to pay the travelers or the travel agencies. But we have, in speaking with AONL, the Organization of Nurse Leaders, and other chief nursing officers around the country, stressing the importance, or having them stress the importance that there should be pay equity all the way around. And of course, nurses are being paid bonuses or, overtime and et cetera, when they are doing that. But those are some of the things. But essentially, though, the major nursing organizations, really, our hands are essentially tied. We can't say you need to pay, this rate or that rate. It boils down to what the market will bear, and also what the various institutions are offering as the pay incentive. So that's an area that we do not have governance over, but we can, stress that, to ensure that pay is equal all the way around, or as fair as best as it possibly can be.
Thank you, Dr. Grant. Another question. In the media, there seems to be groups of nurses who are opposed to the COVID-19 vaccine. Why do you think this is happening? And is there an opportunity to address this in their science-based training?
Guess I'll take that one as well. And I don't know if Dr. Nava would like to, or Dr. Moussa would like to chime in as well. But what I have seen when I have, first of all, the news media, whenever they are interviewing me and they want to talk about nurses who are refusing or opposed to the vaccines, they want to do that because it is a headline. But according to our latest surveys, about 93% of all the registered nurses in the United States are vaccinated. So it's an overwhelming majority of nurses who are vaccinated. It's a small minority who, and it's not necessarily that they are opposed. What I find when I speak with these nurses is that they're getting information from social media which is incorrect. The biggest overwhelming concern that they have is that they have heard that it will interfere with their fertility. And when I sat down one-on-one with these nurses and asked them to look at that resource that they are quoting, or that has caused them to think this way, and ask the following question: who is the author of the article? Is the person a virologist? Are they an epidemiologist? Or are they someone who specialized in this particular field? A lot of times they are not. Was the article published in a peer-reviewed journal? A lot of times they are not. All these red flags that are coming up, and then obviously, point them to reliable resources that they can go to get their questions answered. And usually by the time I finish having that conversation with them, that nurse has made up their mind that they will go and get vaccinated. The downside is that, unfortunately, this is one-on-one. When you may see that there's, several hundred or maybe a couple of thousand nurses across the country that are feeling this way, it's hard to get to them. But I find that by educating them and correcting the understanding that they have, and in saying things like, to this very moment that you and I are talking, there have been no studies whatsoever that have shown that these vaccines will interfere with your fertility. In actuality, the docs of OBGYN and et cetera, they are encouraging women who are pregnant or who are planning to become pregnant to go ahead and take the vaccines because they are considered safe. Usually, again, that one-on-one usually works very well in getting these individuals to really look at things and make up their own mind. And 9 times out of 10, they are going to get the vaccine after doing the research that needs to be done.
Thank you very much, Dr. Grant. And so we are coming on the 8 o'clock hour. However, I do have questions coming in that deal with this topic, and I want to get just one question in about representation in management positions from nurses from racially and ethnically diverse backgrounds. And so one question, I'm going to pose this to Dr. Nava. As a millennial nurse, I find it difficult to get into leadership positions at my hospital, despite having graduate level credentials. And so, Dr. Nava, I know you do a lot with leadership. And so would you take that question? Do you have any tips for younger nurses to get promoted?
Yeah, so taking that leap from, going to clinical practice and into management can be quite challenging, especially if you haven't had experience in management. So that it's a little tricky, and sometimes the education, MSN degree or higher, doesn't necessarily get you in the door. And it's really important to build your network. So I encourage you to go to LinkedIn, look for positions that you might find of interest, introduce yourself. If you're within your healthcare setting, volunteer for quality improvement projects or committees that need additional help. We're always looking for nurses with skill sets to kind of help move projects along, especially those that are facility wide. So I would encourage you to do that to build your network and move up. And feel free to add me on LinkedIn as well. And I'm always willing to talk offline.
If I may add to that, Dr. Davis, one of the other things that I do is I try to encourage those chief nursing officers to essentially begin like a leadership academy, identify, nurses who they think would be good leaders, and, give them, either send them to leadership academies or start your own leadership academy there, invite them to the board meetings of the hospitals, have them sit on the side, but then after the board meeting is over, sit down and talk with them, some of the things that were discussed, how would you handle this, and that type thing, so that you're grooming these individuals and essentially setting up a situation where you may be able to do some succession planning. It could be that staff nurse now wants to become an assistant nurse manager or a nurse manager, or the nurse manager wants to become director of a service line, and et cetera. But that's a great way to do that. Is the chief nursing officer needs to serve as a mentor, and in particularly identifying people of color that if they want to walk the walk and talk the talk, this is the way to do it, because they will find that those individuals will say, well, they're putting an investment in me, so I'm committed. I'm going to stay at that institution, as opposed to, obviously you hate to lose that person, because chances are they've been there 4 or 5 years. They're very well vested. They know your policies, your procedures. So it's just easy for that person to slide into a leadership position should one open up if you just give them a little bit of mentoring and a little bit of guidance. And it shows to that individual too that you are welcome. We want you here. If you are finding it still hard to do that, then perhaps it is time to look somewhere else and take the skills that you have at one institution and let it benefit another institution.
Thank you very much. So we have run out of time, and I really would like to thank our speakers for sharing their knowledge, expertise, experience, perspectives. And I want to extend a very special thank you to you, our audience, for your participation in this very important topic. It's necessary. It's necessary that we collectively engage in these conversations to expand our understanding and really mobilize our actions. We learned a lot tonight. We talked about a lot of different strategies. We brought up a lot of points that need to be addressed. And so what are those actions toward addressing the social determinants of health, advancing health equity, and building more equitable organizations and communities? And I thank you very much for your time.